Working in healthcare is both rewarding and demanding. You'll work with many different people and with countless systems and processes, all striving for the very best patient outcomes. But people, under different demands and pressures, can make errors, and even with good systems in place, things can go wrong, putting patients at risk. If you see that happen, then raising your concerns can prevent immediate harm and is an essential part of improving care for patients in the future.
Patient safety is absolutely essential. I always say patient must be at the heart of everything what we do. And that's the only reason I became a doctor.
I think patient safety in a healthcare setting is everybody's responsibility. It's a collective whole, right from the very top to all the wards or any clinical area.
It's absolutely vital that we see our responsibility first and foremost towards safeguarding our patients and making sure that we deliver care safely and with great compassion.
From wards to boards, whatever your role is across the NHS, it's your job to raise a concern if you spot that a patient is not being cared for appropriately.
However hard it may be, part of caring for patients is to raise concerns when appropriate and to support and respond to the concerns of others in your team.
That's looking really lovely there, Mrs. Baxter. It's lovely and dry. Can you see how the swelling's gone down on there, David?
Yeah, sure.
Yeah. I'm just going to leave that dressing on. All right. And if it's all right with you, I'll come back on Wednesday and check it then. It's okay.
Oh, that's lovely,
Okay.
Wendy. Thank you.
No problem.
Thank you.
Yeah.
And thank you, David.
No worries.
How long are you with Wendy?
Just a few weeks, then I'm on another placement.
Oh, well, you'll learn a lot from Wendy.
All right. So we're going to get away. All right. But I'll
Lovely.
see you Wednesday.
Yes.
So you take care.
I will.
Okie doke. Thanks now.
Bye-bye. Bye-bye.
Want some Joe?
Oh, no, you're fine, thanks. I think that one's looking really good. Should be able to get the dressing off next week.
Wendy, can I just check? It's just, well, I've noticed you've not washed your hands or used cleaning gel yet today. It's just, we're told at uni we should wash our hands before and after every visit. You know, what with the big push to reduce infection.
I've only checked a few dressings today. But anyway, we've had a long day, so go and get yourselves home and I'll see you tomorrow.
Sure.
Okie doke, night-night.
Okay. Bye-bye.
Tricky, isn't it? When you know someone's doing something wrong but your attempts to encourage them to change aren't working. Challenging a colleague can be hard. It might be that they're in a position to influence your career. Maybe they're someone who gets 99% of the job right. But in this case, Wendy is putting her patients at risk.
Hi, Anita. I need a bit of advice. It's Wendy. I don't want it to get into trouble, but I don't think it's safe.
Talking to your supervisor, in David's case his tutor, is always a good first port of call if you have concerns. David may feel disloyal to Wendy, but changing her behaviour can only be good for patients.
Students are so important in this process as they provide a real opportunity to put fresh eyes onto a situation. So I really urge all of our students to not hesitate to raise a concern if they see something that doesn't look right.
Nurse Eleni Donnelly was so concerned about the quality of patient care in Mid-Staffordshire that, having had little success with her supervisor, she went to her board and eventually her MP to help bring about change.
Although it has to be acknowledged that it's a very daunting prospect to have to raise concerns, particularly if you have to go above and beyond your immediate line management structure. For me, the way I nurse is always that I treat patients as I'd wish to be treated myself or a member of my family to be treated. And where that's not happening, we need to address it and improve it. And that was all I was ever trying to do.
Of course, while many concerns relate to the behaviour of an individual or individuals, sometimes you may have to challenge systemic problems.
So, how can I help?
Well, I'm still feeling breathless and it's getting worse. And sick and generally a bit off colour, really.
Right, and we're waiting on an appointment with the cardiologist for you?
No, that was 3 weeks ago.
Oh.
Yes. I wondered if it was the new medication they'd given me. To be honest, They said you would have been in touch with me by now about some blood tests last week.
New medication, there's nothing showing on the system. I don't suppose you happen to have the drugs with you?
Yeah, they're in here.
Right. I think we need to get you those blood tests straight away, just to check your kidneys. Bear with me.
Hi, Mark.
Fatima, Mrs. Jones, we should have had a letter about her new medication from the hospital. She needs blood tests now. Who's free to do them?
Okay, bear with me. No letter today either.
It's cardiology. It's always cardiology. They just don't tell us what's going on.
Jane is in room 3 to do blood.
All right, can you organise that now? Thanks.
That happened last week, you know, with one of Dr. Martin's patients. It's just certain departments at the hospital, but it's just not good enough.
Sally, it's always been like that. Some departments are great at getting their letters to us, and others are always slow.
We need to do something about it as a practice. I'm going to raise it at the staff meeting tonight to see if we can do anything about it.
Good luck.
Sometimes, like Fatima, we accept failures in the system because they feel normal or because we feel we can't change them. Figures show that many people don't raise their concerns because they feel they won't have an impact. But change can only happen if people like Sally both speak up and then follow through their concerns.
If you make sure each and every staff feels happy to come to work, feels supported, they will be there to raise concerns. They will do their best for their patients.
So how should you raise your concerns? In the first instance, it's always best to speak to your immediate supervisor. If you don't feel you're being listened to, then check your local protocol, which should be available on your employer's intranet, to see how you might escalate your concerns. But there are also independent sources of advice. Your regulatory body or union should offer guidance and direction on their own website. And if you want to talk to someone, there are now several phone lines available which offer independent, legally backed advice for anyone with concerns. Details of all these organisations can be found here.
In order to change the culture on raising concerns, it's important that we weave it into everything that we do. But appraisal provides a fantastic opportunity to reflect with your line manager on a concern that you might have had throughout the year.
Any concern you do raise should be valued and listened to, and it could start a process of change.
Hello.
Ahmed, hi. It's Helen Jarvis here.
Hi, Miss Jarvis.
Look, the ward round's running over here. It's just manic. I'm aware that the list is incredibly busy, so take the briefing, will you? It's Mrs. Saunders, followed by Mr. Venables, and then Mrs. Kay, I think.
Yes, of course, Miss Jarvis. No problem.
Thank you, bye.
Dr. Massey, you must have seen a few of these before then?
Yes, I'm getting to know how it all works.
Good morning, everybody. Sorry for the delay. Where's Ahmed?
He's just nipped out. He'll be back in a few minutes.
I'm sure he's told you how busy we are today.
Yes.
Okay, let's crack on.
Should we do the WHO checklist?
Okay, Valerie Saunders, arthroplasty of the left knee, no critical or unexpected steps. Tourniquet up? Yeah. Happy with the equipment? Yeah. Okay, scalpel please.
No. This is Mrs. Kay. Arthrodesis of the left ankle.
I thought Mrs. Saunders was first up. Ahmed, I thought Mrs. Saunders was first up.
She was, but the list changed. This is Mrs. Kay. She has a latex allergy, so she was moved to the top of the list. Didn't you know?
No.
Look, I know we're busy, but I suggest we call this to a halt and do the briefing again.
Thank goodness you spoke up.
This team is clearly under pressure. The surgeons should have been at the briefing. They haven't done their safety checklist properly. But because someone spoke up, this was a near miss and not a never event. And if you do speak up, you should expect a course of action to begin.
Thank you very much again for today, guys. Before you do go, I think it's quite important that we have a discussion about the near miss that happened earlier today. We need to make sure it doesn't happen again, okay?
Raising concerns can feel very daunting, and obviously it's normal to feel very apprehensive about the process.
At the end of the day, your prime responsibility is to your patients, and bullying can be an indicator that things are very wrong.
Things have changed and the processes are improving, especially in terms of education and training, so that people feel able and knowledgeable about the process.
I think there's been some significant changes happening over the last couple of years in the NHS, and boards really do desperately want to listen to what you have to say now if you're worried about anything, whether that's poor practice or inappropriate behaviour. And our role is to make sure that you feel supported and able to speak out, because boards will want to act on what you have to say.
Wherever you work in the NHS, if you see anything that puts patients at risk, you have a responsibility to raise your concerns.